Okay, so we're gonna start. This session will be like miscellaneous stations. Okay, we don't have like it's not like other previous stations. We don't have like one competence, and we're gonna focus on it. No, that's the same case here. So we have like miscellaneous station. You will find healthcare professional stations. You will find over the counter. For this time, we have non-interactive station as well. Okay, I believe it's station number 3 or 4, I think. 3 or number 4, maybe. I think four is like a non-interactive station. Okay, for the first time that we have it like in a live OSCE session. Usually we have it in the mock exams, but for now we have non-interactive station. We're gonna solve it all together. Okay, sure. So we would like to start with station number 1. And we need one volunteer, one candidate. عايزين واحد بقى يا شباب يدخل كده أو واحدة يقول يلا بينا.
نداء. ماشي.
Okay.
ماشي.
We have 2 colleagues who are raising their hands, Sahar and Nida. Sahar and Nida. Okay.
Yes.
Anyone? Yes, Sahar, how are you?
I'm good.
Where are you from?
Egypt.
أجدع ناس.
لا قاهرية.
لا أنت بتتكلمي في مايك ولا حاجة ولا إيه؟
طب ثانية واحدة.
زي مايكات الأفراح كده صح. صدى الصوت أنا سامعين صدى صوت جامد. مش عارف أنت فاتحة جهازين مع بعض؟
طب كده أفضل؟
اوكي. لا زي ما كان واحد للتسجيل والتاني اللي مش عارف
أنت فاتحة 2 مع بعض صح؟
لا أنا كده بقى قفلت الحاجة التانية.
طب خلاص كده أيوة كده خلاص احنا كده هنتكلم عادي. I think Rashmi is here. Rashmi is in. Okay. So يلا بينا سحر عندنا ستيشن رقم 1 هبعت لك دلوقتي. You are on the Telegram group, right?
Yes.
Very good. I'm gonna send you now the first reference.
Okay.
Yeah, station number 1. Here we go. You have the reference here.
Yeah, I got it.
Okay.
Yes.
Okay, very good. Can we have another volunteer who keep the time for us?
ماشي. I will be volunteer. I will do it. I will do it.
Okay.
يلا. 30 seconds, okay?
Okay.
Yeah, you have 30 seconds so you can go through the
reference.
Yeah, Zoom user. Yeah. You can see. You have 30 seconds. Go through the reference, and then we can discuss.
Okay.
Let's start.
Okay. I'm ready.
Yeah, hi. My name is Dr. Robert. I'm a resident here in the hospital. You are the pharmacist, right?
Yeah, I'm the pharmacist. My name is Sahar. I'll be helping you today.
Yes, Sahar. Yeah. My concern is regarding one of your patients,
Okay.
Madam Fawziya McMaster. She's 32 years old.
Okay.
And she's like, in fact, Madam McMaster is like, she's a severe migrainous patient. Okay, she was suffering from now and then from severe migraine episodes.
Oh, I see.
Like, yeah, it's been like 3 weeks or even 4 weeks. I put her on candesartan for a preventive measure, like a preventive agent, and she's getting better. She told me that the frequency and even the severity of the episodes are now much more better and much more tolerated than before, except during like about during her menstruation. She's suffering from I don't know what just before and after her menstruation, she's really suffering from severe migraine. I counseled her to take rizatriptan, but sometimes she needs to take it more than once per day.
More than once per day?
Yeah, yeah. My question is, can we increase the dose of candesartan, like a preventive measure, or can we add another agent with the candesartan to prevent the migraine, the migraneous episode that occur during the menopause?
Okay, so I'll be more than happy to help you with this.
Not the menopause, sorry, during the menstruation. I said the
menstruation. Okay, yeah, I see. Okay, so she's taking candesartan. It's controlling her case. But in the time of menstruation, it's not controlling it well, right?
Yeah, she suffers about, as I told you, she got like the 2 or 3 episodes during her week of menstruation, and rizatriptan is not helping so much.
Okay, so may I ask you a couple of questions about Elsayyad that will help me to give you my best recommendation? Yeah. So, is Elsayyad have any other medical condition?
Like what? No. She's fine.
Only migraine? Okay, and is her migraine with aura or without aura?
What do you mean?
With aura or without aura?
I'm not aware of aura. Can you explain that?
Okay, so okay, I will be back for this, but
usually I'm an internal medicine. I'm an internist, so I'm not aware of like neurological terms.
Oh, I see.
That would be great, yeah.
Okay, so okay, just give me one sec.
Yeah, take your time.
Okay, I'll be back for this, but I'm gonna ask another questions. So, does she take any other prescribed medication other than the one here?
No.
No. Does she have any allergies towards medication or environmental allergies?
Allergies? No, she's fine.
No. Okay. And also, I wanted to ask about her. If you are aware of her lifestyle, does she smoke?
No.
No. Okay. Does she drink caffeinated beverages or alcohol?
Not so much. It's like once every 2 to 3 days.
Okay, that's good. And what about her diet? Is it a balanced diet?
Regular diet.
Regular diet. Okay, that's good. And also about exercise. Does she exercise? Do exercises?
Not that she walks. Maybe yeah. She walks like at the weekend. On the weekend, that's it.
Sorry?
She walks on weekends.
Oh, I see. Okay, that's perfect. Okay. So regarding my question about aura, I just wanted to ask if she is getting this migraine with anything that is causing it, like if she see a light, sometimes it triggers her migraine.
2 minutes left.
Okay.
So is this the case with her? That's what I meant with aura or without aura.
Would you please repeat that because I didn't get you? What do you mean by aura exactly? Because your voice cuts off. Yeah.
Okay. It's if she sees any visual, if she sees any light, this triggers her migraine.
Yeah, she told me yes when she got this episode, like the usually when she got her migraine episode, she got blurred vision.
Oh, I see.
Blurred vision and sensitivity to the light.
Okay.
That's what she told me.
That's good. Okay. Can you give me a few moments? I'm gonna check my
Yeah,
accounts
take your
and get
time.
back to you.
Take your time. Yeah, go ahead.
Thank you.
Time is up.
Okay. Okay. I think I took
Yep.
yeah, I took more time in assessment.
You took so much time in assessment.
Yeah.
So
Yeah,
much
I
time.
see.
You took about 5 minutes assessing the case.
That's
And
too
you
much.
do not cover everything. Even
Yeah.
with minutes of assessment, you missed some questions. Okay, but we will get back to that.
Yeah, okay. Okay, yeah, sure.
Okay?
Okay.
So can we have another copy? Nida, so let's proceed right away, please.
Hi.
Hi, how are you?
I'm good. How are you?
Alhamdulillah. So let's get started.
يلا بينا.
يلا بينا. يلا جازولي معانا ولا ايه؟
Yes.
Okay, يلا بينا. So I would like to talk to the pharmacist. My name is Dr. Fauzi, and I have a question about Madame Fauziya McMaster. She's one of your patients here.
Sure, Dr. Fauzi, please have a seat in our private counseling area and let's discuss Fauziya's case together. So what's your question?
Yeah, Madame Fauziya McMaster, she's severe migraine patient. She has a history of about 2 or 3 years of severe migraine episodes from now and then. I put her on candesartan about 3 or 4 weeks ago. And in terms of frequency and severity of the migraine, she's better now. She's much more better.
Okay, good.
What she's really suffering from is like migraine around her menstruation. Okay.
Oh, okay.
My question is, can we add another agent? Okay, like I don't know if we can add another medication, progesterone, estrogen, anti-inflammatory, anything with the candesartan to help prevent this like migraine episode during menstruation. That's it.
Sure. Okay. So, Dr. Fauzi, if you don't mind, I'm just gonna have to ask you a couple of questions before we go through your question. Is this okay with you?
Yes, why not?
Okay, so I have Fauziya's file here. She's on rizatriptan, the ODT tablet. She takes 1 tablet, and if the migraine persists, she can repeat it 2 hours later. How long has she been on this rizatriptan?
Rizatriptan's been about 2 to 3 years, as I said.
Oh, okay. And she just started the candesartan for preventative as a preventative therapy?
Yeah, almost 1 month.
1 month, okay. And you said her only concern is the migraine when she's menstruating, right?
Yep.
Okay, so May I ask you how many episodes does she get of migraine?
During it, she got a menstruation of about 1 week, and she suffered from 3 to 4 episodes.
Oh.
And during the rest of the months, she's suffering from around 3 from the rest of the months.
Oh, okay. Okay, so would you know if her migraine is with aura or without aura?
Would you please explain?
So aura are the triggering factors that she gets before she gets her migraine. Like sometimes she get some lights or some visions, like visual effects that she
get. She mentioned me like something like that. She mentioned she got fluid vision, sensitivity to light. That's it.
Okay. And do you know if she has ever tried something over the counter, like NSAIDs or anything for her case?
If she's taken any NSAIDs or over-the-counter medication?
Yeah, have she tried anything before?
No.
No? Okay.
Sometimes, yeah. I think she takes Advil from now and then. That's it. On a regular basis.
And it's not controlling her condition?
Yeah, she's taking mainly rizatriptan.
Okay. Okay, Dr. Fauzi, do you have any other question before I check my reference to get you the most updated information?
Thank you. Barakallahu fiki.
Okay, just give me a minute. I'll be right back to you.
Okay.
Sorry, Dr. Fauzi, I forgot to tell you, is she pregnant or breastfeeding by any chance?
No, she's not.
Okay.
Two minutes left.
Okay. Okay, so Dr. Fauzi, according to my reference here, I see an approach we can take with Fauziya. So how would you feel about switching her to another triptan that has been approved to be effective in the menstruation migraine specifically?
Like what?
So I have two options, actually. One is called naratriptan. She'll be taking 1 milligram once daily. And there is another one that's called fravotriptan. It comes as 2.5 milligram, and she can take 1 tablet once daily as well. And it goes, the dose goes for the triptan is the same. So
what's the difference between those and rizatriptan, and why should we go for that?
They are like basically the same. It's just it has been like there are some new studies that prove that these triptans are effective more in the menstruation migraine.
Okay, so no problem. Should we stop the rizatriptan then?
Yes, she cannot take 2 triptans at the same time, so she can be switched to either naratriptan or fravotriptan.
Time's up.
Okay, so we're gonna stop the rizatriptan. We're gonna give her naratriptan 1 milligram.
Yes,
1 milligram every day.
Yes, once daily. Same goes for every triptan. So if she gets the migraine, sorry?
She doesn't have to wait for migraine. She has to take it every day, right?
Sorry, say it again.
She has to take it every day, one tablet daily?
Yeah, one tablet daily, yes.
Daily, right?
Yes.
Okay, very good. That's it.
Okay.
Thank you so much.
No problem. So do you mind if I call the patient and I can give her some self-care measures to avoid the triggers and in order for her menstruation migraine to get better?
Please do. Yeah.
Okay, thank you so much.
Thank you. Have a good day.
You
Okay,
too. Bye.
very good, Nida. Okay, very good, Batim. Okay, so anyhow, your assessment was very good. Okay, you asked about pregnancy, allergy, and etc. And those are the questions that Sahar has missed. Okay, Sahar messed up asking about the pregnancy. Okay, and your assessment was more short and more to the point. This is a very good point, and you went through the reference very fast. You found the answer. Everything is okay, but I think from where did you get one tablet every day?
It says here.
Do we take rizatriptan on regular basis?
Oh no.
Okay.
So maximum 10 days a month.
Yes, exactly.
Yes.
This is number one. Even in the reference that you have, it's not mentioned like that. It's mentioned every day. We start 2 days, usually before the menstruation.
Yeah.
2 days before the menstruation, and then we till I think the end of the menstruation. This is usually
continue for a total of 5 days.
Yes.
So 2 days prior the headache onset and continue for a total of 5 days. Right. I missed this part.
Yes, this is number one. Number two, if the rizatriptan is effective, why should you change your winning horse, as we say? Rizatriptan is good. Okay, it's effective. Naratriptan or triptan, the other one, you would like to prescribe them only during menstruation. Okay, so it's not a problem. It's not a problem to give 2 triptans to the same patient with specifying the indication of each one. Okay, so rizatriptan, provatriptan will be prescribed with the purpose of preventing menstrual migraine or migraine-associated menstruation-associated migraines. Okay.
Okay.
This is okay. So it's not here. It's not a big deal. You didn't answer it wrong. With to stop rizatriptan, yes, we can stop rizatriptan, no problem. But rizatriptan is effective. Candesartan is effective. Okay, we don't have to stop them. Okay, the migraine episode went much better with those medications. What we have to do, we can add another agent only during the menstruation, but you have to mention and clarify that to the patient. She must not mix the two triptans together the same day. Okay?
Okay.
This would be the only precaution. Apart from that, you did everything very well. For me, your communication is very clear. Your assessment is very thorough. So you got all the point. Even your explanation to the aura. By the way, not every doc knows about the aura. Okay, so aura would be okay. You can mention it like it's for a doctor or something, no problem. You mention is it with the aura or no? But expect that some of the doctors may not understand. Okay. You have to be aware of that. And Sahar, this is what was one of your problem as well. You didn't have to explain aura. What is aura? Okay. Usually aura is like a sign that could happen during the migrainous episode. It could be mainly it's neurological sign. Okay. Speech problem, a visual problem, like any other, like drowsiness, anything that could be happen related to neurological source, neurological origin. Okay, this explains the aura. It's very simple. That's it.
Okay.
Okay, my friend. تمام يا نداء.
Thank you.
منين يا
تمام.
نداء؟ مصرية شكلك انت.
مصرية
ماشي يا نداء. اسكندرانية بقى، قولي لي من اسكندرية.
لا مش اسكندرانية، قاهرية.
طيب ماشي. مية مية، الله ينور.
ماشي، ميرسي يا دكتور، شكرا.
شكرا. يلا يا شباب. Very good, Sahar. You did very well, but your assessment should be like more short than what you did. You have to know by heart all the important questions. This is a lady at yeah, she's in the age of the conception. Here you should be you should ask about the pregnancy. This is very important, especially that you are not seeing any contraception here. Okay, for migraine, for menstruation associated migraines, one of the treatment could be contraception. Okay, contraception, combined contraception is like the right medication. In some cases, we give progesterone only contraception to treat menstrual migraines. So this could be a relevant question here to ask about pregnancy. If the patient got migraine episode without aura, and in this case, we could give the contraception. Okay, combined hormonal contraception would be the right treatment here. Especially she's pregnant, she's like a lady and she's not planning to get pregnant very soon. Okay, that's why I told you you missed one important question, which is the pregnancy and breastfeeding, of course. طيب يلا بينا. ستيشن رقم 2. مين؟ We have Karen, we have Ahmed Mustafa. Who's first? Who raised his hand first?
Doesn't matter, anyone, no problem.
Okay.
Don't know, should be
Ladies first. Yeah. Ahmed Mustafa, it seems like he's a guy. So ladies first. Keep your hand raised, Ahmed, please. So you got your
okay.
Next session.
Okay.
Is there any reference?
Yeah. You have 2 references for the station because you are lucky.
Mm-hmm.
Station 2A, station 2B. Okay.
Okay, just a second. I open the 2 reference, make it ready. Okay. Okay, دكتور ready.
طيب جازولي انت معانا؟
يس.
طب ما تنامش دلوقتي.
ابدأ. مش هنام دلوقتي، صح؟
نام في ستيشن 3 الله يخليك.
خلاص انا وانام عادي مفيش مشكلة.
ايه؟
اقول له ركز معايا يا دكتور، عندي بكره موك.
عندك موك؟ والله فين؟
انا عايزه يعني اسسمنت ايه؟
فارماشيب ولا ايه؟ ان شاء الله خير. طيب يلا بينا. Okay, station number 2, you have 30 seconds, my dear. Go through the file, go through the reference. Feel free.
Yeah, let's go. Start.
Hi, I'm Ragda, pharmacist here. How may I help you?
Yeah, my name is. I have a file here, but I'm really very confused. Your technician is saying that you don't have the Ventolin. Okay, I'm really in a bad situation here. and I would like to take Ventolin because it's been like 4 days that now I'm suffering from difficulty breathing, and I cannot get hold of my doctor.
I'm so sorry to hear that. Please have a seat in our counseling area. I'd like to ask you more few questions to find out what's the problem. Is our technician told you about the shortage?
Yeah, you don't
Okay.
have Ventolin.
Yeah.
Buffer.
And you don't have any at home?
No, I don't. I'm running out of it.
Okay. And may I have your name and age first?
Yeah, my name is Big Mac Cheese.
Mm-hmm.
I'm 30 years, I'm 20 years old.
20 years old. Okay, Big Mac. I
Cheese.
can see your profile here. And may I know how is your current condition? I mean, are you feeling like shortness of breath or
Yes, exactly.
wheezing?
Yeah, exactly.
Okay, any shocking symptoms?
Shocking symptoms?
I mean, like any, is the shortness of breath too much severe, or I mean, like you still?
I can still walk and run. It's okay, but I'm not comfortable.
Okay. Any confusion, any vision disturbance or blurry vision?
Blurry vision? No.
Mm-hmm. No. Okay. And may I know how many times you're using Ventolin during the last week, for example?
Last week, I usually take the maximum, 8 buffers.
8 buffers. Okay, 8 buffs per week. And do you have any like night symptoms? I mean, you wake up at night and coughing too much?
Yes, sometimes.
Okay, and are you keep taking, I can see that you are on Flovent, the orange buffer as well. Are you taking it regularly?
Yes.
Okay, and you stopped taking Symbicort and Montelukast like a long time ago.
No, I didn't take them.
You didn't take them. Okay, Big Mac, do you have any allergy?
No.
Okay, are you, do you have any medical condition apart from asthma?
No, only asthma.
Okay. Are you on any prescription medication apart from the 2 buffers?
No.
Okay, any over-the-counter medication?
No.
Any herbals, vitamins?
No.
Any recent change in your lifestyle happened recently? Maybe the reason behind the more often use of blue buffer?
No, I don't think so.
Okay, I am out of stock totally in the store of salbutamol.
Mm-hmm.
Okay.
You asking me?
Yeah. I don't know, it's not clear here.
It's your technician told me that.
Okay. I mean, no expired Ventolin in the store.
Expired?
It's not expired. You don't have in stock.
I don't have it. Okay, no problem. No problem. Okay, and are you using Flovent regularly, Big Mac? Like, I mean, twice a day?
I swear to God, yes. I swear to God.
Okay, perfect. And nothing happened, maybe recently happened to your lifestyle, maybe worsen your current asthma condition?
No, I stopped eating the Big Macs from Mac. That's it. This is the only change.
Okay. So actually, the current condition is not like, I would not, because I don't have any Ventolin, and at the same time, you need to be assessed by your doctor, Big Mac. You're using Ventolin more frequent, which is mean like you are not controlled and you are not stable. Your asthma condition is not stable. And do you have an asthma action plan with your doctor? Told you what is the next step?
No.
Okay. So yeah, I just need to have a look in my reference. I will get back to you.
Go ahead.
The sharpest object in the world is soft and formless. Le téléphone à quelqu'un qui m'a jamais battu. Je le passe un móvil a la persona con más tatuajes de coche y con la misma nota de defensa de FIFA 2026. Yo le paso el móvil al capitán que tiene un rating de 89 en defensa en la FIFA 2026.
Do you have a right to go to a nearest walk-in clinic, Big Mac?
There is no walk-in clinic open now. It's like Friday night, everything is closed. And as I told you, I cannot get hold of my doctor.
Okay, no. So actually, Big Mac, I would advise you now to go to nearest emergency. Because your symptoms get worse and you don't have like action plan with your doctor for the next step, what you're gonna do. Especially, I don't have even Ventolin here, but I might go to.
Time is up.
Okay.
Time is up, Ashana.
Okay. طيب يا كارن، انت ايه مشكلتك في الموضوع؟
Karen.
كارن، يس. كارن اسمك.
I have معلش يا محمد, I'm sorry. I have many concerns here. Are you asking the patient if I have a Ventolin in the pharmacy?
لا I'm not asking. أنا عايزة أعمل يعني ألم الكيس, مش فاهمة أنا شوية.
أنا سألتك يا كارن، سألتك أنت بتسأليني قلت لي بسألك.
And then you asked him, not even any expired Ventolin. Are you giving, even if you have an expired Ventolin, are you going to dispense expired medication?
If he need, I will. Until he go to the emergency.
ده مين اللي قال لي كده؟
Who said that? Sorry. Seriously, who said that? In which province they do this?
No. I know it's not allowed, but it's like I should wait.
How come you keep expired medication on the shelf? How come?
Okay.
You cannot do that. Okay,
that's illegal. If you say this in the like Karen, لو قلت الكلام ده هيتقبض عليك.
ما تخافش, فاهمة والله, بس يعني I mean it's risk و benefit. It's يعني
الكلام ده ما تعمل
If the patient will die, I will give him the
مين يا عمي؟ ضاي مين اصلا؟ ايه اللي ضاي؟ فنتولين بياخدها عشان خاطر الازمه بريك ثرو اتاك. خلاص جميل.
طيب شوف الاستيشن جازولي
ياخدها مكانها في ايه؟ مش فاهم.
اسمع بس يا حبيبي, اسمع يا حبيبي.
سوري, في مجال بس للمداخله بس لحظه ولا لا؟ اخر شيء الحمد لله منيحة, عرفتني دغري.
عايزة تعملي الاستيشن؟
لا, بخصوص الاكسبايرد بس للبوينت حتى ما انسى. اليوم I was reading about shortage. هلا في ما بعرف اي province, I forgot reference بخصوص النيتروغليسرين. I mean يمكن هل في كندا حتى حطيتها صار في nitroglycerin spray shortage. بس I mean if I have the reference at the station I could use it, صح؟ لأنه عملوا لها extended expiry date. يعني هي expired.
عملوا extended expiry date.
Yeah.
It's not the same situation here.
It's not.
That's not the same. We cannot generalize. Okay, so it's like a different.
Unless I have something, يعني هن قالوا لي إنه عاملين extended expiry
date. So you have a reference in your hand, you have documentation in your hand, you can use it to make your judgment. But here you have nothing.
Okay, yes. I solve the case. I solve the case, but I will be silent until the next person do it. No problem.
You solved the case?
Yeah, I did.
قولها لي بالعربي كده.
هعمل له continue care لسمبي كورت. It will work as a rescue.
بس خلاص في ايه بقى؟
Would you please explain that? Would you please explain that to other colleagues so we can get the station solved?
Okay, no problem.
So
So
what's the main problem here? What's the main problem in the station? What were you trying to solve here?
first of all, I was trying to roll out any red flag of severe shortness of breath. Even he is feeling like severe shortness of breath. I would give him any rescue right now until he go to the emergency, and as long as I don't have any Ventolin, but he had Symbicort in his file long time ago, and I will do a continue care under the pharmacist name, expanded scope of practice. I will use my expanded scope of practice.
No need يا أمي, no need. ما هو عنده أصلا on hold. No need. What do you mean by expanded the scope of
okay,
practice?
sorry. I didn't get that. Refills, yeah, he does have 6 remaining refill. Sorry. Yeah, no problem. I will give him Symbicort. It will work as a rescue, of course.
How long, for how often per day?
As long as he needs, no problem. Like
up to how many puffs per day? Symbicort can be used for as a rescue medication.
I don't know this information.
8.
Perfect.
ماشي. طيب حضرتك لحد ما يعمل ايه بقى؟ معلش انا اسف، لحد ما يعمل ايه؟ لحد ما يحصل هيستخدم السيمبيكورت لحد ما يحصل.
Until he has a visit with his doctor, because he need to
يعني emergency.
No need to emergency, but it wasn't clear for me, does he need emergency or not, because like
emergency عارفه هيروح يعمل emergency هيعملوا له ايه؟ هيديله بتاعت فنتولين ويرجع لك تاني.
اوكي.
كارين يا جميله، كارين هو انت بتقفي جازولي، استنى بس. كارين انت وقفتي في صيدليه قبل كده؟
يس.
طيب ماشي. انت عارفه تسمع عن الدراسه بتاعت اسمها ايه الدراسه بتاعت السيمبيكورت؟ نسيتها. ستار.
Yeah, I knew it. At the first moment I find out, but I don't know, maybe because I was like nervous.
You have the reference, even if you have never heard about that, you have the reference in your hand. Okay, you didn't go through the reference. Simply speaking, okay, you decided to send him to the emergency room. I don't know why, actually. I have no idea. It's been he told you that it's been like 3 or 4 days. I'm trying to get hold of my doctor, but I couldn't. That's why I'm here. That's it. So why sending him to the emergency room? Okay. Doesn't make sense. You have the solution and you have the case, you have the treatment in your hand, and you have the reference as well. What you can do here, you can dispense Symbicort. There is no Ventolin, so go ahead with the Symbicort. Dispense Symbicort. In dispensing Symbicort, what should we advise the patient? Any precautions here? There's any precautions to follow?
Yeah, wash your mouth after using the Symbicort. And
what else?
It's different use already. Like just a quick hint about the use of Symbicort.
Yes, very good. This is a very good one. It's a different technique. Okay, and last one. Last precaution here. What is it?
Not more than 8 doses in a day.
Very good. Okay. There is one more missing.
She always have it on her all the time.
Should have what?
She always have it on her all the time as a reliever.
Yes, no problem. She can do that.
في كونسيرن لو انت وقفتي في الصيدليه، في كونسيرن كبير جدا بيجي من الناس بسبب السيمبيكورت. يقول لك دي مش شغاله، دي فاضيه، دي ما فيهاش حاجه. خصوصا ان هو هيسويتش من ماست زي فنتولين مثلا، حاجه بتطلع بيشوفها قدامه، لباودر مثلا او كده زي السيمبيكورت. السيمبيكورت ما بيحسش بحاجه.
He will not feel
لازم تحذريه لما بيسويتش من HFA لسيمبيكورت. لازم تحذريه. You're not expecting any mist or anything. ده فرق كبير يعني. ماشي؟
اوكي.
طيب وبعدين بقى
جايز الله يبارك لكم. جايز
The flu vates.
There is interaction here. Okay, there is duplication.
Doubling the corticosteroid.
Yes, fluvaticasant.
Stop
Yeah.
Flovent. Stop Flovent.
Please stay focused. Okay, stay focused here. Okay, he's taking already the Flovent. Okay, he's taking it every day, twice daily, and you're gonna give him Symbicort. Should he keep using the Flovent?
No, he should stop it and use one Symbicort as rescue and as a maintenance therapy.
Exactly, that's it. So we're gonna stop Flovent and we're gonna switch to Symbicort. Okay?
Okay, perfect.
That's it. Thank you.
I should fax his doctor at the end and document.
فرج الله خلصنا.
أحمد.
Yes, you should fax.
الدكتور يا كريم لازم يعرف الموضوع ده عشان خاطر هو بيستخدم واضح ان هو بيستخدم فنتولين زياده لان هو لو انت تلاحظي هنا he picked it up 10 days ago وخلصت منه تمام؟
Yeah.
فلازم يبقى فيه مثلا نوع يعني راح اكتب له بريدنيزون او كده فاهم قصدي؟ كده يعني.
One more thing. When you fax your doctor, what you're gonna mention to him as well? What will be like a recommendation from your side?
Action plan and
yes.
Yeah.
بس action plan خلاص نقطة من أول السطر بس ما تزوديش action plan. Okay. You would recommend to give him action plan to avoid any similar situation in the future when he got infected or anything. How to control his asthma. Okay.
Thank you.
So far, so good. All is clear. Do you have any questions? It's not like it's not a tough one, but it's not easy as well. You have to read the reference carefully, and if you are aware about the technique, the star study, and the something, you would have solved that very easily. Okay.
Oh, I have a question. Like, will we be asked about the technique without a reference? Like, do we have to know how to use all of these?
What should. The technique of what? Of the inhaler?
Devices, yeah.
No, so here it's not a counseling. It's not a main counseling. Okay, you have a DTP here. You have a problem, solve it. About the technique, yes, it would be fine to explain him the technique. You would mention as well. If you are not aware about the technique here, just mention him. You will find on the package like a YouTube video. I would recommend to see the YouTube video to how to use the Symbicort. Because the technique is different. It would be enough to mention the technique is different. Okay.
Can I heard some other, sorry for interrupting. Someone said like we can say the technician will explain to you. Can we still do that or unacceptable?
No, unacceptable.
Unacceptable technician.
I heard it once. I'm checking. Okay, I'm sorry. I have another question because a lot of people are expecting to get a case about shortages. So, like, is there a way by which another way we can handle shortage if there is no way like this? What should we do?
Nothing. Same thing like this. If there's going to be a shortage, there's going to be an interchange. Simple as that. يعني لو هيبقى في shortage هيديك بديل. لو ما فيش بديل خلاص ما هنعمل ايه يعني هو احنا هنخترع.
اوكي.
بس خلاص. انت عارف انت اشتغلت في الصيدليه يا جماعه قبل كده على طول في شورتج على طول. هو عندهم احنا اصلا جزء من حياتنا اللي انت بتغير اتورفاستاتين لروزوفاستاتين ومن مش عارفه الفنتولين لسيمبيكورت ومن مش عارفه ايه لايه عادي جدا كل يوم في شورتج. اذا كان البيركوسيت كان فيه شورتج اصلا الجينوفيا كان فيها شورتج الجينيمت كان فيه شورتج عادي خالص ده جزء من حياتك كفارماسيست يعني تدي بدائل على طول ايه المشكله يعني خلاص. انا مثلا انا عندي واحده بيشنت ماشي ودي ريلاف كيس خلاص الدكتور بيكتب لها 3 ادويه سيبراليكس مثلا 10 و20 ماشي وميثايل فينيديت 10 مللي جرامز واللي هو ريبرينول خلاص السايكايترست ماشي الريبرينول دوت بقى له فتره كبيره جدا جدا في اونتاريو مثلا داخل له في سنه يا اما ديسكونتينيود بعض الدين نمبرز يا اما شورت مش موجود وانا ابعت للدكتور يقول لي لا ما هو لما يجي لك الريبرينول تبقى تدي بس خلاص وعامل له اون هولد. طب يا عم ادي له براميبيكسول ولا حاجه اللي هو ريستلس سندروم يعني اديها اي حاجه ثانيه. لا مش عايز، خلاص ماشي، خلاص ما فيش، خلاص هنعمل لها ايه؟
اوكي.
طيب انا اسفه بس اخر حاجه، ممكن يجي لنا مثلا ان احنا نغير فورميوليشن، يعني بيشنت مثلا كيد وبياخد مثلا سسبنشن، فلو ناقص هديله تشوبل تابلتس، حاجات زي دي بتيجي؟
بتيجي عادي وحاجه سهله. دي بقى الاكسباندد سكوب اللي في اونتاريو. كريم مش موجود اديله اوينتمنت، اوينتمنت مش موجود اديله كريم، سابلينجوال اديله تابلت، عادي جدا يعني. بس تشوبل مكان مش عارفه ايه، سيرب. انت مش عارفه ان في الاموكسيسيلين في اونتاريو ناقص بقاله برضو 50 سنه.
سوري اصل انا ما بنزلش صيدليه. تمام.
كارن عارف الموضوع ده. عادي عادي يا جماعه، ما ده جزء منك انت كصيدله، حتى ايفن في مصر يعني عادي، ما فيش قلق. لكن يعني خد الموضوع بصدر رحب كده وشوف بديل. لو ما فيش بديل خلاص، ما فيش بديل خلاص، احنا اسفين هنعمل له ايه يعني؟ انت فاهمه؟ بس الموضوع تمام.
Very good. Okay. So, any questions? Only one question, if you have. If you don't, so we have to continue to proceed with station number 3. يلا Gazouly. Okay, أحمد مصطفى.
الو،
يا باشا
ايه الاخبار؟
100 100. يلا بينا.
يلا بينا.
Very good. Okay, station number 3. I think we have. Wait. We have reference. What we have? Tobacco. Oh, tobacco. Do you smoke, Ahmed?
لا نو.
Smoke shisha.
لا بطلت الحمد لله.
طيب يلا بينا. امسك التايمنج يا محمد بليز.
هو الريفرنس في التليجرام؟
Yeah, I sent you the reference to the Telegram group.
Okay.
Oh, yes, you're supposed to have it now.
Okay, I got it.
Okay, you have 30 seconds. Go ahead.
Okay.
Yeah, go ahead.
Hi, I'm Ahmed, the pharmacist. How can I help you?
Hi, my name is James. I need a prescription filling here. I believe you got my prescription in fax to you guys.
Sure, James. Would you have a seat in our private counseling area so we can discuss it more?
Yes, for sure.
You are 51 years old?
Yes, I am.
Okay. May I know why did you see your doctor, James?
Well, I smoke a lot actually, and we decided to quit smoking, me and my doctor finally, and he gave me this prescription to quit smoking.
Okay, sure. Congratulations for this big decision, James.
Thank you so much.
Okay. Okay, so the new prescription is nortriptyline, 25 milligram daily for first 5 days, then increase to 100 milligram a day for 12 weeks. Did the doctor told you anything about the medication?
Yeah, he told me the first 5 days is going to be lower dose, and then we're going to increase it to give the full effect after.
Yes, that's what he wrote. May I ask you some question before I dispense the medication for you?
Yeah, go ahead. Yeah.
Do you have any medical conditions, James?
Medical condition? No, I don't have any other medical condition. I'm pretty healthy.
Okay, good. And do you take any prescribed medication?
No.
Do you have any allergies of any kind? Do you have allergy from medication or food or
no, man,
environmental?
No. I love food, specifically like I eat in the go actually, and you know, I'm a truck driver, and I usually eat like McDonald's, pizza, all this. Like I love this yummy food, man. Yeah. Don't have any problem with food. Don't worry about it.
Okay. Okay, James. Did you try anything for the smoking cessation before?
You know what? Yeah, I remember I got, yeah. Sorry about that. My doctor is giving me something called repiglinide. And that's because like he said I have like borderline diabetes. So I usually get repiglinide. And that's from another pharmacy actually, but not from here.
Okay, so you are taking repiglinide right now? Like
yeah, I think it, yeah.
Okay. Did you measure your diabetes recently?
It's usually, yeah. It's every month I go for a checkup. It's borderline. I'm not
okay.
It's borderline.
Okay, and you take it right before food, or how do you take it?
Right after food.
Right after food. Okay, good. May I ask you some question about your lifestyle? Do you drink alcohol?
I drink 2 cans beer at night.
At night? Yeah. Okay. And do you have time to exercise?
No, I don't exercise now.
Okay. How many cigarettes per day do you use to smoke, James?
Almost a pack.
Pack per day. Okay.
Yeah.
Okay. Give me a second, James. I will get back to you. Okay. I'll check my reference. I'll get back to you.
Okay.
Do you have any other concerns before I check my reference?
No.
Okay, thank you.
ذاكر ال SOS صح شكله كده.
I forgot to ask you, James. Did you put a quit date for smoking cessation?
Yeah.
When it will be?
I believe after discussion with my doctor, he said like 1 week after I start medication.
1 week after starting medication?
2 minutes remaining. 2 minutes remaining.
Okay. And you told me you have tried anything before for smoking cessation?
I've tried the gums and stuff, but it didn't work with me. It didn't work. I didn't like it. Gums and lozenges and all this over-the-counter stuff. It didn't work.
Okay, James. Okay, James. So this medication is unfortunately one of the side effects is dizziness. And you said you are a truck driver, so I would recommend you take something else. So I would fax the doctor to prescribe you another medication that will be less have less side effects like dizziness, because you are a truck driver, and it would be not the best option for you.
Like what? So you're not gonna give me this medication?
Yeah, I would say there is like other option that would be better.
Okay. Like what? What do you think?
Like variant clean.
Okay. I heard about this too.
Yeah,
Okay.
it's called, the brand name is Champix.
Champix, yeah, yes, I heard
yeah.
about. And is it a
Yeah,
good
so
one? High success rate?
Yeah, this is a very good one and it has very successful rates. So I will fax the doctor for you, like to write this one,
Okay.
because of the side effects of the medication you, the one the doctor prescribed. Also, I would recommend you try to take like healthy food, because you said you always take junk food. It will be a good option as well.
Okay.
There is a self-care measure that would be also beneficial. Try to avoid any company that are smoking. Try to
بس يا باشا كفايه كده خلاص.
كفاية؟
time's
طيب
up.
ماشي.
You're done. You're about 8 minutes I think.
Yeah.
انا حسبتك ازاي دقيقة زيادة.
بس انت كريم جدا الحمد لله.
الحمد لله.
شكرا.
Okay, very good Ahmed. Thank you so much.
شكرا.
اتفضل. انت سمعت السيشن دي قبل كده؟
مش بالظبط يعني، شفت في حاجات زيها سمعتها في الاوديو صح؟
في الاوديو بتاعنا صح؟ انا قلت كده برضه.
لا هو مذاكر، هو مذاكر عشان سألك سؤال. هو سألك عندك اي كونسيرن قبل ما تدخل ريفرنس. ده تكنيك انت عارفه ولا سمعته مننا برضه؟
لا طبعا منكم يعني.
ايوه بس كده.
هو خبيث. خلي بالنا
كنت لسه هقول لك الفاكسينيشن.
جدع برافو عليك بقى. بص I respected وكده that's why you did it properly بأمانة يا جدع. انت مذاكر وزي الفل.
بس الحمد لله الكيس يعني
So let's turn to English, guys. Let's turn to English because we have non-Arabic speakers.
Okay. So that's
okay.
So nice assessment. It was very thorough. Yeah, you pick up the concern here, the DTP, the guy that's a driver. Sometimes the occupation may interact with the medication, which is like any other normal person. Nortriptyline can be used, yes, but it's not the first line. That's true. It's maybe it's third line, I think. It has the dizziness, which is a main concern here in this patient. As a truck driver, it may lead him to risk of accident or something. So you asked a very good question. Did you try anything for smoking? I said NRT, and it didn't work. So then you moved all the way to Champix, which is the best option here. I agree with you. Self-measure, you said you only say one, no problem. Non-farm, you fax the doctor. Totally solve it. Totally solve it, man.
شكرا.
Thank you.
Okay, very good. And your recommendation, Gazouly, you didn't ask about the weight gain, right?
No, ما دخلتوش بقى في الحتة دي بصراحة.
ما دخلتوش هو سألك بس. Okay, everything went well, Ahmed. Thank you so much. But what about the assessment time? You took so much time in assessment, or it's not like I thought? How many?
Yeah. I think I took more time. Like I was a little confused in the beginning, but I tried to figure it out.
Yes.
That's why I didn't tell you about any medication except the peglinide, and that's it. And then because it was mainly concerned here the dizziness and stuff. But
okay. So anyhow, there was another concern about the weight gain with the patients taking repaglinide. Repaglinide is a diabetic medication. One of the side effects of repaglinide is the weight gain, especially when the patient quits smoking. You know, the risk of weight gain after quitting smoking. Okay, so the risk here would be augmented, would be higher. So what would you recommend? You would recommend changing the repaglinide to another non-weight gaining agent? Or if you would ask about the diabetes as well, what about your diabetic? What about your last A1C? Is it controlled, not controlled, and etc.? If it's controlled, you can recommend something like from the
Ozempic or something, GLP.
yes, Ozempic or the Trulicity, something like that. It could be a good option, especially with smoking cessation. Okay, sounds good.
ماشي.
Any questions about this station? All is clear? All is clear?
I wanted to add something also. I was
بقول يا
concerned.
فاطمة والله لسه بقول يا فاطمة عارف انك
I had a concern too. If I was doing the station also, amitriptyline causes weight gain. يعني with rapaglinide, he eats junk food. يعني, so all in all, it wouldn't be a good option. Not only for the sedation and drowsiness, but also for the weight gain. And
Yes.
second line. Yeah.
Yes.
Yeah, that's not the first line. بالظبط.
Mm.
Yeah. ماشي.
Okay, very good, guys. Bravo. So let's proceed. Let's go. Yeah, non-interactive stations. Very good. It's a very interesting one. So what you're gonna do now, you can all solve this station at the same time if you would like, but we would have one candidate. He will be like the sacrificer. He will sacrifice his answer in front of you. And you can write down your answers. If the patient, if you're gonna dispense the medication, so it's okay. You don't need to justify anything. If you are not going to dispense, you have to write down your justification. Why? Okay. Okay. Sounds good. Amin. Okay. Let's go. Rashmi, how are you? Are you following up?
Yeah, great, sir. Great. I'm doing good. How are you?
Good, thank you. Nice to meet you again. Nice to see you again here, my dear.
Thank you. Yeah, thank you very much.
Okay, so let's get started, guys. Who's gonna take the non-interactive stations? We have 6 prescriptions. Who's for it?
ماشي مريم.
Who is for it? Mariam Shehata. يلا يا مريم. خش يا جزول.
Okay.
Okay. Okay, you will be allowed 7 minutes as well. You have to give a justification if you're not gonna dispense any of those prescriptions. As I explained, if you're gonna dispense, so it's okay. No need to justify.
اعرف كده أول.
يلا جزول. 1 2 3 هوب.
يلا واحدة.
Here you go. This is one moment. This is the first prescription. You can say dispense or not dispense. If not dispense, write down your answer. Do not make any justification now. Okay.
Sorry,
Maria?
I have a question. Like, do we have the original prescription or only the label and the product?
There's no original prescription.
Okay.
Okay. So are you done with this?
Sure.
Dispense or not? Are you gonna dispense or not?
Oh, should I answer now? Okay, so the product's not going to be dispensed because it should be fusidic acid cream, 2%, not hydrocortisone.
Exactly.
Okay, here you go. مريم انت رحت فين؟
I was waiting for you to signal for me. Sorry.
سيجنال ايه؟ ما تقولي هندسبنس ولا لا عشان نكمل.
Okay, so like I don't get amount of time and then you tell me to speak. Sorry. Okay. So
مفيش،
I'm
انا
not gonna.
مفيش وقت، انت عندك 7 دقايق للستة كلهم على بعض، فانت لازم نتحرك.
Oh, okay. I'm not going to dispense because the different drug identification number, so it should be filled from the stock bottle.
Okay. So you're not dispense this one. Okay.
Okay.
When you are done, please say dispense or not. That's it.
Oh,
So,
okay. This one I'm going to dispense.
Okay.
dispense this one. Okay. For what reason?
Yeah. So it's same product, same strength, I believe.
Yeah.
Will not dispense because it's the same product.
Sorry, I am going to dispense.
You're going to dispense. Okay.
Yeah.
This one I'm not going to dispense. This is different strength.
Yes.
Okay.
Okay.
Because it's different strengths, right?
Yeah.
Okay. ماشي.
The first the PhD round.
شغل شوية الصورة بعد إذنك.
Okay. Sorry?
Yes, what's your question? What's your answer?
Oh, so this is the different strengths as well. It should be 250 over 25 and it's 250 over 50.
وفي حاجة تاني ثواني بس وفي حاجة تاني This is not complete answer. في حاجة تاني.
Oh, okay.
Advise our اشتغل للمستوى state or artificial intelligence.
أقولك ولا
Actually, I don't know. You can share with us.
This is discuss or this is MD?
Discuss on MD. Oh, yeah.
Yeah. Okay.
Okay. Can I see the Can you just scroll up a little bit if there is a dragon? No, up. Like if there is a DIN that I can't see. Yeah. So they're different product as well. I will not dispense. Should be 21 tablets and this one contains 28. I'm not sure, like, I think this could be a problem, right?
انزل تحت يا محمد كده بعد إذنك. انزل تحت. هو هات لنا آخر واحدة دي. Are you going to dispense this or no?
I think I'm not going to dispense because different, because it should be 21 and on the one dispense it said 28.
Yeah, that's it.
Yeah,
That's
it's
it.
okay. Yeah, it's okay. 21, 28. Good.
No,
So
seriously.
this is that.
Give me 1 second. This is
Yusuf Tawfiq, but so
Yusuf.
I'm telling you, I'm telling you something. For Yusuf Tawfiq, there are some people who's not Arabic speakers, so they will not get it.
Yusuf, that's a wrong patient too. Okay, Yusuf is a male gender. Okay, just think.
In Arabic,
I'm sorry. I'm sorry to ask you something. Should we have like the sex? Because especially for English speaking, sometimes
No,
a female could.
I agree with you, but just for yourself, like that's.
Yeah. Thank you. Yeah, because sometimes we have females called Alex. It gets me so confused.
I agree with you. I agree with you.
Okay.
Anyways, we put it here. Like male gender sometimes can be considered as well. Okay.
Okay.
If you got, for example, like, anyways, but it can be considered. Okay.
Okay.
So very good. Your name is
Mariam. Yeah.
sorry معلش مريم شحاتة. طيب تمام يا مريم. Okay.
You met me once, actually.
قابلتك once فين؟
No, you met me here. I mean, like on the online sessions. It's not the first time I speak to you.
Yeah. We spoke before. You mean? اتكلمنا مع بعض قبل كده يعني في.
Yeah. I did a case and we had a discussion after it.
Yes بالظبط. بس هو معلش الأسماء دخلت. بس احنا عندنا فاطمة، عندنا سارة، سحر، كله دخل على بعض. طيب. Okay, so this one is okay, as you said. We're not going to dispense it because this is fusidine H. Fusidine H is the antibiotic, fusidic acid combined with hydrocortisone. Okay, it's not the same medication here. It's only fusidine, so that's why we are not going to dispense that. This medication, as you said, the DIN is not the same. Because this are tablets. While here, it's like you have capsules. This is number one. Number two, it's not the same generic. It's Teva. This one is not Teva. That's why the DIN number is not the same. Okay. So yes, we are not.
In this case, there will be two problems.
No, only one. If you identified only one, I think it would be fine.
Because I always assume they are interchangeable unless the doctor specified a brand, but correct me if I'm mistaken.
No, if you don't have the exam, they will give you like it will be more clear. But if there's a wrong number in the exam, so that's a wrong number.
Okay, thank you.
معلش عندي سؤال في اللي فاتت. لازم يكتب الديوريشن ولا مش لازم عشان انتي بايوتيك؟ مش لازم.
عدد الحبات هو خلاص هو معروف 10 حبات هياخد 2 في اليوم بالعقل كده يبقى 5 أيام. مش لازم. هو الأفضل إنك تكتبه بس in some cases لو ما كتبتش يعني أنا ساعات التكنيشنز بيدخلوا يبقى واخد اوجمانتين 7 أيام بيدوله 14 حبايه تيك 1 twice daily ما بدقش يعني بيدينا فاهم فبقول لا 7 أيام خلاص.
اوكي شكرا.
Okay, here we go for this one. Yeah, this is the only prescription that we're gonna dispense. Okay, exactly. So this is right. Here we're not gonna dispense. You said it's not the same strength. I don't know why. Why it's not the same strength?
Because I read inside 75, but maybe it's 150 and I misread. Like inside
Sorry? انت شفت في العلبة جوه 75. صح. Yeah, exactly. Same. برافو. Okay. ده مش هندسبنس خلاص. جازولي قال السببين بتوعها ودي خلاص. عمنا يوسف هياخد أليس. But this is not the main. مش عشان يوسف على فكرة، ممكن يبقى يوسف بس هو مغير اسمه. Okay, transgender، فده بيحصل كتير. Okay, فده مش reason. It's not a reason enough. The reason is why we're not gonna dispense, because this is 28 and you have 21. Okay, if you have a male taking contraception, this could happen. In Canada, this could happen, and the vice versa. You can find the female patient is taking testosterone injections.
Yes, or she can even take tamsulosin, by the way.
But if on the test, like they will tell us, right? Like they will not say it's a male or female.
You may, I don't, for in the OSCE, you mean?
It depends on the OSCE station, by the way, because I got before a homosexual patient before in one of, I believe in my exam. I remember it was a long time ago, but I think I got a homosexual patient, and they can that I'm homosexual, and you can deal with him as per his, whatever.
No, I understand, but the thing is, like you said, because some medications can be.
محمد هنا قصده انك انت يعني مش ده الريزون، يعني لو يوسف واخد oral contraception, it can happen. ممكن vice versa. A lady is trying to switch her gender and she's taking testosterone. We cannot say, okay, that's wrong because she's a female, because you assume it as a female.
But will they give us heads up? Because otherwise it will be contraindicated if she's not trying to.
I agree, but I believe it will be clear in the exam.
مش هديك فرصة إن أنت تعملي assumption.
في
واحد كده
هيقول لك يس.
هيقول لك لو سمحتي ما تقوليليش، مستر قولي لي مدام. ده بيحصل عادي جدا.
ده بيحصل عادي جدا في الديلي بيزنس في كل صدى، عادي يعني مفيش مشكله.
اوكي ثانك يو فور ذا كلاريفيكيشن.
حصلت قدامي بقى، ده كان واحد بيجي بدقنه بشنبه بكل حاجه، اقول لي مدام كاترين مثلا.
يس
مدام ايه انا بتاع ما تجمل. هو كده مدام.
هو هي كونسيدر، هو هي سيز هيم سيلف كده. تمام.
عادي، فدي مش سبب enough. It's not a reason enough. Okay. So let's move forward. We have station number 6. Station number, this one, station number 5. This is not 6, this is 5. Sorry. رقم غلط. This is station number 5. Okay. Volunteer. We need a volunteer. I love this station. I love the coming station. I love it so much. The fact is the actor is female. Maha El-Fiki is asking if the actor is a female, so the patient is a female or a female actor. For example, can pretend to be a male? No. It doesn't happen. If she's a female, then you have a female. Okay. مش زينا احنا بنستعبط يعني بالعربي. احنا بيبقى عندنا فيميل فبنقول انا اسمي فوزية، لكن كده لكن لا يعني في الامتحان مش هيبقى كده. مش هيعملوا زينا يعني. اوكي يعني shortage of resources guys. We don't have a female assessor with us. That's why. Hopefully ان شاء الله لما حد فيكم ينجح يجي يساعدنا بإذن الله. Very good. Okay, station number 5. Who's coming? نداء تاني. فاطمة بقى.
Okay. I have a question before the station, please.
دايما عندي questions يا فاطمة.
مش أحسن نسأل questions بلا ما نروح على الإكزام وما بنعرف. في بخصوص مرق معنا دوكسيسايكلين and فيلافاكسين non-interactive. So both can difference the doxy capsules or tablets, the venlafaxine strength of the product. Should I write the reason in the exam different than number ولا بحط specifically إنه the strength should be 150 for example وهيدا capsules ولا بحط both then number and إنه capsules?
The more you clarify it, the much better it is.
Okay.
The more you clarify, the much better it is.
Okay, thank you. Okay. يعني هلا hopefully this station would be good لأنه ما فيها reference.
No, but then
ماشي يا محمد موف اون.
طيب يلا بينا شباب. مين معانا؟ فاطمة قلنا؟
Yeah.
يلا فاطمة. نداء, because you did one. Okay, that's why we privileged Fatima for this station. Just one moment, Fatima. Excuse me. Give me 1 minute.
Take your time. It's fine.
Okay. Okay. يلا بينا.
Yes.
Fatima, you ready?
Yeah.
Okay, here we go. Gazouly, 7 minutes, please.
7 minutes, please.
Yeah. Yes, hi. I'm a patient here.
Hello. Yes, and I am Fatima. I'm the pharmacist on duty today. How may I help you?
Yes, I have a patient. I have a file here. Okay.
Yeah. Okay.
Actually, you serve me guys usually my medication in a blister bag.
Okay.
Okay. So, but I, because I was out of the home all the day today.
Oh, I see.
Skipped all my medications. I didn't take any.
You skipped all of them? Okay.
Yes. That's why I would like to know if I have to take them all now. Should I skip ones or should I don't know.
Yeah. Yeah, sure. I can help you with that. Okay. So may I know your name and age?
Yeah, my name is Setabuha Lachance.
Okay.
My date of birth is 1st September 87.
Okay, fine.
Yes.
Okay. So what was the reason that you forgot your blister pack like at home?
Yeah, I was out. Yeah, I was on a picnic trip with my friends, and I forgot to take.
Yeah, this must be worrisome, but I will try to help you. Yes, there will be some medications that you can take now, some others you cannot. Just let me take a look at this. Okay. So you're taking levothyroxine 150 microgram, and you are maintained on it, so no side effects. You never skipped any tablet before?
No, levothyroxine, no.
Okay. What about clonazepam?
Usually I take it twice daily.
Yeah, okay. And I see here that you're taking polysaccharide iron in the morning with venlafaxine, risedronate. Okay, so these medications, you've been on them for a long time?
Yes.
Okay. Okay, let's check here. Okay, so the levothyroxine, you usually take it at an empty stomach, right? On an empty stomach?
Before dinner time.
Okay, let's see. Now it's 7:30 p.m. Have you had your supper already or dinner or not?
It's 7:30? No, not yet.
Not yet. At what time do you take your dinner?
In 30 minutes.
Okay, 30 minutes. So now I will assume you have empty stomach right now, right?
Yeah.
Okay. And okay, let's see. 2 tablets. Okay, could you give me a moment to collect my thoughts and just write a few notes before telling you what to do? Okay, thank you. When you take risedronate in the morning, do you take it usually with levothyroxine?
No. Risedronate, I take it before breakfast.
Okay, and on which day of the week do you take risedronate?
It should be today.
Today also, okay.
يلا يا بنت الجبل.
مكتار.
يا بنت بيروت يلا.
مكتار يلا. Okay, so let me, do you have any symptoms now or you're feeling fine?
What symptoms?
Like, I don't know. I just need to ask, like you're okay, right? You can take. Okay.
Should I feel any symptoms?
No.
Okay.
No, you shouldn't. Okay, so the levothyroxine, usually because on an empty stomach,
yeah.
You can take it now because you shouldn't. You are taking dinner after 30 minutes, so you can take it now.
Okay.
But don't eat anything or drink anything until dinner. Okay. You can just take it with plain water.
Okay.
Clonazepam, we have to skip the morning dose. You can take the evening the afternoon dose that you usually take it, but take it after you take dinner. Okay.
After I take dinner, okay.
Yeah, you can take it at bedtime.
Okay, usually I go to sleep at 10.
You go to, okay.
So I take my dinner in 30 minutes, it will be 8. Yeah, 1 hour later, I take my my 2 cups of every night. Then yes, 10 would be fine. Usually at 10, I can take them.
Yes, you can take the clonazepam. The iron, let's assume, let's see, you take dinner at 8 p.m. Unfortunately, okay, so we can either skip the levothyroxine or I can give you the iron tablet. Okay, since when did you start levothyroxine?
5 years ago.
A few years? Okay.
5 years ago.
5 years, and you're maintained on it. You did your lab work. Your doctor did your doctor tell you that you were good with the thyroid? Okay. Yeah. Okay, so let me skip the levothyroxine for now. We can skip it now.
Time is up.
Yeah. Oh my God.
الليفوثايروكسين معقد لك حياتك مش
لا
عارف.
انا مش عارف، انا عشان كده قلت بقى
شويه قبل الفطار، تحط شويه بعد الفطار.
عقد لي حياتي لانه ما في ايرون.
في ايه؟
You need to space it, that's why. كان لازم اعمل له سكيب وخلاص.
طب ما سكيب الايرون يا عم، في ايه؟ هو الايرون ده خلاص يعني ما بلاش بلاها
مثلا. Okay, guys, no problem. Okay.
Oh my God, I took really 7 minutes وما عملت assessment ولا شيء.
Yeah, the good times fly. Yeah, the good time.
بس ما أنا انصدمت أول okay, I was really shocked on why too many medications like benzodiazepine و SNRI
Okay. So Fatima, thank you so much. Let's try with another colleague, Jose, and at the end we're gonna tell you what we can do there. Okay. So another candidate, please. Do we have another candidate? Who's raising his hand? نداء كانت رافعة يديها. انت فين يا نداء؟ رشمي.
أيوة.
Take it. رشمي اللي قالت
okay. Sorry. No.
Okay.
مش رشمي.
مش رشمي هتقول لي أيوة. Okay. So Rashmi still here?
Yeah, I am here. Okay, let's try. Actually, it seems to be a little difficult, so let's try.
That's not difficult at all, my friend.
Okay, let's try.
Yeah, okay. So,
should we start? Yeah.
Yeah, 7 minutes, Gazouly?
Yep.
Yes, so let's get started. Yes.
Yes.
So, yeah. I have a file here, guys. My name is Setta Buha Lashans. Yeah.
صغير فتحة صيدلية بتورنتو فتحة صيدلية بتورنتو ودي يسوون فري سيشنز مال هاي فهاي أنا المريض ست أبوها خشم ما أدري شنو
بتكلمي مين طيب؟ مش عارف سامعينك مش عارف
ما جبتي
should we start؟
حتى الهندية بنص
ايفون عشان اعملي ميوت عشان احنا سامعينك اللي فاتحه صيدليه في تورنتو عسل النهارده يوم لذيذ مش عارف ليه كده في ايه طيب يلا بينا sorry Rashmi, we're gonna restart again okay okay then yalla keep the time please Rashmi, are you good to go?
Yeah. Okay. Yeah, let's start. Hi, I'm Rashmi, the pharmacy student. How may I help you?
Yes, my name is Tabua Lachance. I have a file here in the pharmacy.
Okay,
actually, you give me all my medications in a blister bag. But unfortunately, I forgot to pick them up with me, to take them with me and my picnic today.
Okay.
Yeah, so I missed all my 3 doses of today. Okay.
Okay.
As you know, it's 7:30 p.m. now. So I would like to know, should I take them all at once now or what should I do?
Okay, Boha, I'm just going to assist you on this way. So I can understand sometimes we can forget the medications, but now we have to find out a solution how to cope up with it. But make sure in future, you take care, you must carry your blister bag. So here I have a list of medication with me, and I can see you are taking lots of medications. So may I ask you a few questions before giving you any recommendation?
Yeah, sure, definitely.
Yeah, so I can see you are taking levothyroxine and you are taking at 12 p.m. every day. So is this medication effective for you and is it working for you?
Yes, I take it. Yeah, that's stabilize my condition. Yeah.
Okay, that's great. And you are taking clonazepam 0.5 milligram and you are taking 2 times in a day. And you skipped both the tablets today, right?
Indeed, yeah.
So which condition are you taking clonazepam?
Anxiety.
Anxiety, okay. And you are taking iron as well once daily at 8 p.m., right? And how are you doing with your iron, iron store? Did you get any blood work?
Yeah, it's okay. I have to take it for 1 month, I think, for 1 month more. Afterwards, I will redo my blood work, and then we can decide on.
Oh, that's great. And you are taking venlafaxine as well, 150 milligram. So which condition you are taking this one?
Depression.
Depression, okay. And you are taking 2 capsules at 12 p.m., right?
Yeah, exactly.
So is your condition controlled now?
It's better.
Oh, that's great. And you are taking Visdronate 35 milligram. At what day you are taking this medication?
Should be today, Thursday.
Should be today, okay.
Thursday, yeah.
Thursday, okay. And you are taking norethindrone 0.35 milligram once daily. So, sorry?
Contraceptive.
Contraceptive, yeah. So you are taking regularly, right?
Yeah, every day.
Yeah, okay. And you are taking quetiapine 100 milligram for which condition?
The quetiapine is for like a somnifer, like a sleep pill.
Sleep well, okay.
Yeah.
So you need to take regularly, right? Without any miss?
Yeah, with that, yeah.
Okay.
Every day I take it, no, not when needed, it's every day.
As needed or every day?
No, not every day.
Oh, every day, okay. And you are taking lisdexamfetamine for which region?
Wait, yes.
For what?
Every day. It's for concentration.
Okay, okay, every day.
Energy and concentration, yes.
For concentration, okay. And you are taking bisacodyl 5 milligram tablet, 2 tablets for your constipation, right?
Yes.
Okay, so Setoboha, I have a concern, like we cannot take all the medication at this moment. We have to skip some medication for today. So what would I recommend you, like for your levothyroxine, like I would say, like we can take it tomorrow now because it is too late and it will not accommodate with your food and all the things. So at what time you are supposed to take your dinner?
My dinner should be in 30 minutes.
In 5 minutes?
30 minutes.
In 30 minutes, okay. Yeah. Okay, so I would suggest like we should skip iron tablets and levothyroxine as well, because levothyroxine should be taken empty stomach. If you are taking just now, so
okay.
So out of this medication, I found like the most important is for your concentration, I think, or
yeah, my concentration. Yes, the one that lisdexamfetamine, the 40 milligrams.
Yeah. So okay. I would recommend, like, are you taking it with food or without food?
Sometimes with, sometimes without food. Should I take it with food?
Yeah, you can take like just now you can take your
should I take it with my dinner? It would be fine, I think.
Yeah. Actually, I am thinking to give you only like 3 medication at this moment. Those are very important out of those all, because Risdonate you can take weekly. So tomorrow in the morning you can take it. There is no problem. And but iron you are also taking in the morning. So tomorrow you have to like separate Risdonate with iron. That will be very important. Okay. So
should I take 2 tablets tomorrow of iron?
No. Tomorrow you are taking Risdonate 1 tablet at 8 a.m. and iron you will take like space up with that. So you are not taking at 8 a.m. 1 tablet. So you need to space them.
Okay. So okay. I'm gonna take stick iron in the morning, 8 a.m. and the Risdonate I have to take it at 12 p.m. right?
No. Risdonate you take at 8 a.m. early in the morning, empty stomach, and you can skip once more iron tomorrow. There is no too much problem like skipping in iron. So because it restores your iron, like stores gradually. So it will be no harm. So you can skip tomorrow iron dose and you take Risdonate.
Okay, no problem.
Okay, that will be good. And just now, like I would suggest like you take lisdexamfetamine. That is for your concentration and it should not be skipped. So it will be good. And tomorrow at 8 a.m. you can skip it.
Okay. So okay. So just to make sure that I'm following, for lisdexamfetamine, I'm gonna take it now and I'm gonna skip the dose of tomorrow morning, right?
Yes.
Okay, very good. What about the others? The one for anxiety and depression?
Yeah, anxiety tablets you're supposed to take at 5 p.m. and 8 a.m. So yeah, I would recommend like you take clonazepam also just now. That will be good for you. Clonazepam, yes, for anxiety.
Okay, so I should take it now.
You can take now clonazepam at.
So now I'm gonna take my dinner Okay, usually I'm gonna take my dinner in 30 minutes.
Then you are taking your dinner.
But if I take it now, I should sleep, right? Or it's not?
Yeah, after taking your dinner, you can take your Quitya pint.
Usually I
That
take my
is for
dinner. Usually I take my dinner and I take afterwards, like 30 minutes after, I take 2 cups of wine. Then I go to sleep about 30 minutes later. So
Okay.
I can take that when? In the
So-
dinner and cups of wine and or at the bedtime.
So you are gonna sleep at 8:30, right?
I'm gonna eat at I'm gonna eat at 8. I'm gonna eat at 8 and sleep at 9.
Sleep at
10. I sleep at 10.
Okay. So let me recollect again my thoughts. So you have to take
What about
norepinephrine.
venlafaxine? My question is to Rashmi. What about venlafaxine? Yeah, give me an answer about that. The venlafaxine and norethindrone. I need an answer.
Both these two medications are very important. Yeah, you cannot skip. Venlafaxine, I will say you should take 2 capsules. So
Venlafaxine, we should take 2 capsules. Okay, that's it. I would take it with food. I assume with dinner, right?
yes, you have to
very
take
good.
it.
What about norethindrone? Yeah.
Norethindrone, you can take like because it is you can take norethindrone also like today only, because you should not skip this medication. It is your contraception medication, so they are very important to take.
Okay.
So you should take this one as also with food or without food, no matter.
Okay, so I'm gonna take the venlafaxine. So in conclusion, my dear, levothyroxine, I will skip it. Right?
Yeah.
Clonazepam, I will take 1 tablet with my wine, 2 cups of wine, correct? Polysaccharide iron, I'm gonna skip it for today. Venlafaxine, I'm gonna take it.
Yes.
I'm gonna skip it today and take it tomorrow.
Yes.
Norethindrone, I'm gonna take it today.
Yes.
Quetiapine, we don't have an answer about it.
Quetiapine you can take at bedtime, because you are not gonna sleep without quetiapine, right?
So quetiapine, we're gonna take it.
Before sleep.
This dexamphetamine, we're gonna take it. It doesn't matter if we take it or not.
Yeah, clonazepam, I am worried, like you should not take with beer, because it is going to give you more of side effects, maybe breathing, depression. So it will be worsening the symptoms actually. So skip clonazepam as well.
So I should skip clonazepam as well.
Yeah.
Okay, very good. Thank you, my dear.
I am actually not too much confident with this.
It's not me neither. Honestly speaking, me neither. It's not as you did, like there's so many problems with your choices. Okay. I need one of the colleagues explain us what are the problems here. Rashmi did like some mistakes. Did some mistakes.
I didn't take the full chance. خلص الوقت بس كنت بدي أحكي.
يا بنت الجبل هديكي فرصتك، هخليكي تحكي للصبح. تمام؟ استنينا.
Let's Sarah.
Rashmi did some mistakes. Okay?
Yeah.
In her choices, they are not the best scenario that we can follow. Somebody needs to explain. We have Sarah, we have Fatima. Both of you,
me and Sarah are good friends, so I will give Sarah the chance. يلا Sarah, أحكي if there's anything else I will add. Okay.
Okay. For the norethindrone, the patient should use it as soon as possible. Besides that, she has to use a backup method because more than 3 hours, she's supposed to use a backup method. This is the first thing. For the let's take dexamphetamine. The patient should skip it, otherwise she wants to sleep. If she took it the way that Rashmi said, the patient, will be awake that day.
Rashmi, you did.
The
problem is the patient told you, I'm taking quetiapine to help me sleep. Okay.
Yeah, it will be insomnia.
And although you put here the Vivans at the bedtime. Oh my God. 3 months at bedtime, it's like and 40
Yeah,
milligrams.
it will be stimulant. Yeah.
Oh yeah, she will be dancing all night.
Yeah.
Okay? This is a problem. This is number one. Yes, go ahead. Continue, Sarah.
Okay.
So you
And
can,
for the iron, yeah, maybe the iron and the levothyroxine is not very important. The patient can skip them. That's what I'm thinking. The risdronate, the patient can take it the next day.
Wait. For iron, there is no problem. We can skip it. خلاص? The patient is not gonna die. Okay?
Yeah.
For the iron, it's not a big deal. Levothyroxine, usually, you know what is the bone?
The levothyroxine is a long-acting.
The bone approach, the bone approach, the good approach that we have to follow here for levothyroxine. What should we do?
Other than skip
if a patient skip a dose, can we give levothyroxine tonight? What do you think?
We can give. I think you once said we can give 2 doses at the same time. It's fine, right?
Bravo. But my question is, can we give levothyroxine tonight or no?
No.
It's better for the patient to be consistent on it, to take it at the same time.
No, it's not the right answer. No. Why we cannot give levothyroxine at night?
كمان it causes disruption of sleep ولا بلا thyroid.
Could be, yes. Should be taken on empty stomach. This is number one, Maha al-Fiqhi. This is number one, should be taken on empty stomach. Yes, this is the best. It's not like, it's not obligatory to take it by empty stomach. It's better to take it on an empty stomach. Okay, this is number one. Number two, levothyroxine is thyroxine hormone. Okay, it can makes you feel awake, makes you stay awake. Okay, during the first days of treatment, like when you're counseling your patient about thyroid or centroid or levothyroxine, you may mention to him, take it in the morning. It may give you some vigilance, may give you like a hyperactive, or may give you some buff. اسمها ايه يا ابني بتقولوا عليها ايه؟ السخونية.
fever.
يا عم لا. Hot flashes. Yeah, it may get some hot flashes. Okay, so those are one of the symptoms of levothyroxine. Levothyroxine gives energy in most of the cases. That's why giving levothyroxine at night risks to keep the patient awake all the night. Okay, so what we better to do? Better to postpone the dose for the following day, and here, as Fatima said, we can double the dose. Because usually with the levothyroxine, we calculate the dose on the weekly dose. Okay? If the patient skip one dose, he can double the following dose. No problem.
Another thing grabbed my attention here. You told Rashmi that I will take clonazepam with 2 cups of wine.
Yes, bravo. This is one of the concerns.
This shouldn't be given with wine. Of course.
Stop wine.
ده كمان 2 ده قلت لك كوبايتين واين. صحتي وصحتك.
So here Sarah said you shouldn't give the medication with wine. Yes, that's right. But you should stop the wine to give the medication.
Yes,
right?
Very good.
Okay.
Very good.
Yeah.
Okay,
So
قول يا Gazouly.
Yeah, the concern here is not the medication. The concern here is the wine.
Yeah.
Because you put it in a way that like the medication is the concern. So.
No, I'm sorry. I'm saying about the drug alcohol interaction. Like shouldn't be given.
Yes.
Yeah.
Just tell her to stop the wine. Yes.
Exactly.
Okay. I have another point.
Yes, go ahead.
For the iron, okay, it grabbed my attention here. Iron is given with risedronate in the morning.
Yes.
It shouldn't be given with bisphosphonate. Yeah?
Yeah. Risedronate given once a week. What's the problem?
Yeah, I know, but what I know is that
You mean the
bisphosphonate
absorption?
shouldn't be given with any other drug, especially iron. Like both are given at 8 a.m. in the blister pack. You know what
Yes.
I mean? Yeah.
Okay.
This is not a big deal. Why it's not a big
We should
deal?
space
Some of the patient, no, in some of the patient, I give levothyroxine at the same time with calcium.
Really?
Okay. Yes, I did it before many times. Why I did that? Because I'm asking the patient. Here in Quebec, we don't ask. We go through we have something called DSQ. DSQ, you have all the blood works and everything he did in the past, and you can verify that with the patient. So what I did, I go to this DSQ, the patient file on the internet, okay, to find the his last blood work. And I found that thyroxine is good. It's like in target. So why should I change? And I'm asking the patient, are you taking this together?
Oh, I
All the
see
time,
what
he
you
tell me,
mean.
yes,
Yeah,
I'm
yeah, I
taking them
see what you
together. I'm taking them together all the time.
Yeah.
Okay, fine. Why
So
should I?
yes, exactly. So what Mohamed is trying to say,
Yeah, yeah.
yes, by the book, if you go by the book, yes, so levothyroxine should be taken on empty stomach. However, some patients take it with food, some patients take it with multivitamin, and their doses are maintained on this habit. Okay, so keep it as it is. So you have to ask the patient if you're taking with food. Some people say yes, we take it at night, at food, whatever. So yeah, keep it as it is, no change, because their levels are maintained on this situation. Okay.
Okay.
Clear.
Okay, another question. Since the patient will not use the iron that day, what about the Biscodile?
I wouldn't give the Biscodile actually.
Biscodile is not a problem. You can give or not.
Yeah.
It's not a big deal for Biscodile.
Okay.
Okay.
So if we skip the
What
iron,
else?
we still can give it?
Yes, no problem.
Okay.
As you like. Biscodile is not a problem.
There is a
Okay,
question here.
by the way,
should make sure
Yes.
one of the questions should make sure how the patient takes the residronate. Also to remove it from the blister pack. No need to remove it from the blister pack. It just you can counsel on it. That's it. I usually put it in the blister pack actually. And just let them take it like the first thing in the morning, and 30 minutes before, like space out 30 minutes or something, or 2 hours or something like that.
Yes.
Fine.
No need to remove it. You can counsel, but here, what I'm saying, if the patient, it's been a while that he's taken the same pills together, okay? And if you decided to remove the iron from that day, you are talking about residronate, not the levothyroxine. Okay. No, so it's not a problem. If he's okay, then he is okay. You want to change, no problem. You can do. You can do your professional judgment here. It's not a problem. Okay.
Okay, I have a
I
question.
have a question before we skip. Sorry.
Maria.
So I was checking Synthroid monograph now to follow up with you, but it says don't double the dose, so I'm confused.
What's that? The monograph? Yes.
Synthroid monograph, yeah.
No problem. You can find this information in monograph. You can find another information in another reference. Doubling the dose is like one of the approaches that we did. Okay. So it's according to your judgment as well. If you would like, yes, usually doubling the dose is not a problem. You can double the dose with Centroid. If you would prefer to skip the dose, then skip the dose as you like.
Okay, thank you.
Skipping one dose out of 20 or out of 30 doses per month, it will not cause harm. Okay.
Okay, thank you.
According to your decision. For me, doubling the dose would be accepted. Because I read this information before in one of the references. I think it's RX Vigilance or something. I'm not remembering. But I say it before in one of the lectures, and I showed the reference that we have. Even in some cases, patient can take the whole week's dose at one day.
No, I believe you. The thing is, are they gonna provide us with a reference, or will it be on our own if we get something like that?
As you said, you can do what you have to rationalize it. You have to justify your answer. That's it. Okay.
Okay, thanks.
Right by your whatever the way you will justify your answer, it should be like an accepted way. Okay.
Now what about the vanilla vaccine?
But about what? Yes, vanilla vaccine. Good question. Okay, so Rashmi decided to give the patient the vanilla vaccine with
No.
V-Balance. Okay.
No. Vanilla vaccine, I should not give, right? I got it.
But yes, but you told me yes, take vanilla vaccine.
Yeah. And what about stimulant? Like when we are giving it on the next day, 8 a.m.
Next what?
That L-dexphentamine 40 milligram capsule. When we are giving next day, like are we skipping it now?
L-dexphentamine, you cannot give it at night.
Yeah. So we are giving tomorrow, like
tomorrow morning, my dear.
So we are giving Risdronate with that we cannot give, right?
No problem. Risdronate, you can give it before meal. This when the L-dexphentamine, you can give it with meal if you would like, no problem. Okay, but you shouldn't give it at night. Venlafaxine as well. Effexor, the venlafaxine as well. It gives energy. Okay, you cannot give it at night. It will keep the patient awake. Okay.
Yep.
That's it. Okay, and for norsyndrone, as Sarah said, you should give a backup method.
Yes.
For they skipped more than 3 hours. This is progesterone.
Yeah, progesterone only. Yep.
Okay.
So no clonazepam.
Clonazepam with wine. I wonder. You told him skip clonazepam and take your wine. I wonder. It was really strange.
So what to do?
I told you what to skip. You said skip your clonazepam, and you didn't mention anything about the wine.
So what to do? Like in actual practice, like should I give
wine? Do not take wine today. Do not take wine tonight, and you can take clonazepam to help you sleep. That's
but it is for anxiety, right? So it is not like for sleep.
She's suffering from insomnia. Okay, she's taking clonazepam, and she's nervous. She's stressed. That's why clonazepam would be a good one as well. She skipped the today's dose, the morning dose. It would be like a good action to give her at least one dose today.
Okay.
Not give her 2 cups of wine. Okay.
I have still the last question. Okay. So
promise this will be your last question today?
I can't promise you. I'm sorry. Last question on this case. Okay. I think the session is over. So levothyroxine, many patients like we see take levothyroxine.
One moment, Fatima, I have to stop. Yeah, I have to stop recording now so we can continue. Okay, here you go.
Yeah, so many patients take levothyroxine and bisphosphonate. Supposedly this patient like takes the iron at bedtime.